uh, very peculiar name, I might say. So at Yale University, they created the first problem-oriented medical record information used in health management. There were private corporations that developed computer systems, a consortium of University of Utah, 3M, and Latter-day Saints Hospital, and Massachusetts General Hospital and Harvard also created a computer system, and the Registry Institute in Indianapolis created a system. Now, all of these are useful to get a historical handle on how far we have come in this business. In the 80s and 90s, highlights of groundbreaking software and other developments included computerized registration, which meant that patients were able to benefit from a more efficient electronic check process. In 1990, the World Wide Web was invented, established. While this had nothing to do with healthcare per se, it established expectations that people had about information management, because people could easily access information from various sources. Now, the most important developments for electronic medical records is what happened in 1994 when the World Health Organization adopted the ICD-10 coding standard. ICD means International Classification of Diseases. There was ICD-9 before that. It got improved, enhanced, and more coded in ICD-10. And that main the main coding system, in fact, used worldwide as of this time. Lastly, from the top of the millennium up to now, there have been massive developments in ICT coupled with intense government and non-government interventions, especially in the advanced countries, that led to the emergence of true electronic health record. The true electronic health record is the communicative cross-departmental electronic record system. It is communicative and it goes across departments, it goes across disciplines, it goes across specialties. Now, let's agree on certain definitions. What is ICT in healthcare? Because if we don't have an agreement, there will be plenty of arguments afterwards. Essentially, it is the use of information and communications technology to enable, enhance, and optimize. Some practitioners take it to also cover the use of ICT in care. In fact, for example, with which I'm very familiar, the mental health social care, because essentially a lot of things can be both without needing to duplicate efforts or resources. Broadly, ICT in healthcare includes electronic health records and clinical decision support systems. I'll talk a bit more about that. Telehealth, which is secure electronic communications between healthcare organizations and also branches, colleagues, and with patient service users. So telehealth is not just about you and your doctor interacting. It is also about your branch in a village in Ondo State being able to communicate effectively and securely for head office in Lekki, in Lagos. That is also telehealth. In fact, organizations use that more than they use it for direct patient interaction. Now, there is also the ICT culture in a hospital or practice, including cybersecurity. That is, in fact, perhaps more important than most people realize. And of course, there are the therapeutic and diagnostic gadgetry or equipment, including the use of robotics in physical therapy and surgery. Now, people have heard of electronic health records, but they are not all made from the same cloth. They are not the same. An EHR, or electronic health record, is a record of a patient's total health information that is optimized for sharing with other providers or organizations. We'll come back to that element sharing again and again and again. An EMR is essentially the digitized or digitalized version of the paper note folder that we generally get from the records rooms in hospitals. You also might hear of clinical record system. It's essentially the same thing as an EMR. And then clinical decision support system is a computer program or system that enables clinical diagnosis and treatment. For example, I implemented a clinical support system for a teaching hospital in the UK back in 2005, and enabled them to become a cancer center of excellence. Essentially, what it did was that help them to present the treatment, the diagnostic options for cancer, the types of cancer, to the clinicians, the doctors, the nurses, and the therapists at the point. So that's a clinical decision support system. It's not replacing the health practitioner, helping them, is supporting them to do what they do. You might also hear of hospital information system, an enhanced EMR focused on hospital administration. So very, very quickly, what is the difference between an EMR and an EHR? They are not the same thing. Now, an EMR is an electronic version of a local clinical paper-based information, which was mentioned. It's mainly used for patient care within the local facility. Records are not optimized for sharing with other providers or organizations. The fact that you can create a PDF is not really sharing. The fact that you can do a screenshot of patient records and send it by WhatsApp, that's not sharing, because it doesn't really solve a lot of the clinical requirements. So we'll talk about sharing later. An EHR is an electronic of the patient overall health information, both local and distributed. In other words, an EHR includes a lot of different things, not just the local information of that patient. It's a core component of and decision policy making by government and organization, West African Health Organization, the Pan African Health Organization, all those multilateral agencies cannot do their work if you don't have data from the EHR system. That's optimized for sharing with other providers and organizations. So, as a doctor, you've seen a patient needs to be referred to a hospital in Dubai, and instead of typing things out on paper, printing it, and not being sure who gets interface you don't need to copy of the hospital, and you send the information in real time. So we're not there yet, but that's the whole idea. Now, you may also hear of the expression health informatics. Now, that is very confusing. No, it's not really. Health informatics is a field of study, but it is also the generic term that covers all electronic records in healthcare, but specifically avoids the technical distinctions between them. So health informatics includes everything from EMR, CDSS, clinical decision support systems, and all of that. Essentially, health informatics objects are real-time, patient-centered computer records that make information available instantly and securely to authorized users. you will see I have three concepts. Information is available instantly, it is secure, and it's to people who need to know. Information that is delivered on a need to know basis falls into the health informatics. If anyone can just walk into your medical records room and access any information they want without any restrictions or sanctions, then there's something very wrong in that thing. But we'll touch on that when we talk of cybersecurity a little later on. Now, health informatics also helps to reduce the incidence of medical errors by improving the accuracy and clarity of medical records. Facilitates the extraction of actionable insights. You hear a lot about actionable insights when decisions about big data are had. From the masses of data continually being collected in the healthcare setting. It also helps by making it easier for the healthcare ecosystem, not only to collect data, but to also quickly and reliably process, analyze, and deliver the data to those who need it, including to any device, mobile devices, for example. Now, I'll just run through some of the applications to which health informatics have been or is being put. Patient scheduling, management software, electronic health records, medical billing, patient portals, e-prescribing, medicine, and telehealth, and quality reporting. You'll be glad to hear that health systems that demonstrated to you on the Helium Health System does all of this and more. That's why I told you, you are going to get a Ferrari, a Lamborghini, and an Aston Martin without even trying. Now, why should you care as a medical practitioner or as a healthcare provider or as someone interested in the healthcare space in Nigeria? Why should you care about all of it? Well, quick, accurate, up-to-date, and efficient access to patient records and streamlined coding and billing for HMO and health insurance purposes is top of mind for most doctors. Why? Because one, health insurance is the way to go, because most people can't pay for the kinds of healthcare interventions that are required, so they need insurance. And so you have to deal with organizations called HMOs. Some people will say it's bad karma, but let's not go into that. The important thing is that for you to have sensible and stress-free relationship with HMO, you have to have information that is accurate, that is timely, and that is streamlined for coding. And you also need to be interested because securely sharing patient information, patients and other providers is becoming increasingly important in healthcare, not just in Nigeria, but right across the world. You also want to reduce costs to providers and patients by enabling more efficient diagnosis, decision support, and reduce medical errors to make prescribing more reliable and essentially safer care. ICT to improve productivity and efficiency, easy availability of information for social care and policy making. And basically, if you don't remember anything at all up to now, please remember this bit. Basically, you want the right information at the right time, at the right point of care, and health informatics goes along with the right information at the right time, at the right, very important. Now, let's quickly do some comparison. This one is a very easy one. Because, very simple, very straightforward, but extremely depressing. And that is that in developed countries, Europe, US, Canada, health informatics adoption rates are usually north of 90%. In some places, it's even 99% of healthcare facilities and practitioners, depending on the organization and all of them. In developing countries, including Nigeria, the metrics are inverse. In other words, more than 90% of healthcare facilities do not make meaningful or significant use of health informatics. That is extremely pressing. Why? Because it's 2022. As Professor Killer was saying, technology is making a difference. Do you know that banks in India are able to do more than banks in the United Kingdom do? Now, in fact, some of the innovation in UK banking system have been in use in Nigeria for 3, 4, 5 years. You know, so technology is making a difference. But somehow, in the health space, it's opposite. There is so much resistance that it is mind-boggling. Some of the reasons are fairly straightforward, but a lot of it is cultural. It is habit. It is not wanting to step outside the box. People tell me high implementation costs, you know, to buy the services, to buy the kits, train people, limited supply of relevant IT skills, infrastructure challenges, electricity, internet connectivity, and in addition, now, all of that, I repeat, all of that is meaningless. Why? Because adoption of any technology is a personal, some would say cultural thing. It's got nothing to do with internet connectivity, for example, or electricity. People go on Facebook, they manage to charge their phones, they have data. A lot of the electronic health records or EMR systems use less data than Facebook does. Because Facebook is always updating things in the background. So when I talk to people and they say, oh, it will cost me data. Hello, you already use data for what? So what's all this, the cost of data excuse? Before now, what were the usual for getting and using EHR, EMR in Nigeria? The systems were not produced with the right experience by people who know what medicine and know what IT is. The systems were not produced or introduced, and a lot of systems in the Nigeria space. Again, you'll be glad to hear Helium Health is way above many of them. Very expensive systems. I have heard of systems implemented with budgets of close to 10, 15, 20 million. Now, that, believe me, is ridiculous. Has gone so far now that there is no need to market that way. Now, what is telehealth? Telehealth is generally the sending and receiving of health information from one location to another. You send information from point A to point B, the information or communications technology. So it involves leveraging audio and video, or sometimes all, or phone technology for medical consultation and treatment 24/7 by 365. Now, there are some examples of usage, but this is by no means an exhaustive list. Telehealth is used in general practice, medical management, care, for example, sleep. A lot of people have sleep issues, and the sleep specialist will use telemedicine to come to a diagnosis at some point. Cancer care, elderly care, both residential and domiciliary care, public health administration and population. Now, what are the various forms of health? Now, you hear of telehealth, telecare, telemedicine. They're not exactly the same thing. To know the difference or what separates them. Telehealth is using technology for remote diagnosis and evaluation of patients, as well as remote detection of changes in the patient's condition. It's all usually encompasses the global term is encompasses care and telemedicine. What telecare essentially is monitoring. A lot of elderly people, different parts of the world, use telecare devices. For example, they wear a pendant that if they fall down, it will register that they've fallen down, because people want to live independently on their own. And so those devices alert a monitoring station or something, and people can then send to this individual. Some people even adapt telecare for child protection. You know, children are going to school, they have a device in their school bag, nobody knows it's there, and that's a geo tracker. If that child goes out of a certain area, they know exactly where the child is and all of that. The child doesn't even need to say anything, for example. So there are many variations. Telemedicine is the use of ICT to provide remote clinical and social care services to patients and service users, and to share information. Now, I will get a bit technical here because I think it is important for certain parts of our audience. In telemedicine, there are three main types, or three implementation options. There is asynchronous telemedicine. Asynchronous means that it is not happening in real time. So asynchronous essentially is used for sharing static information, you know, similar to an email or a chat. It's secure, but you see a patient, you write some notes, you send it across. That's asynchronous communication. There's remote patient monitoring or telemonitoring for tracking patient vital signs and activities without video or by a care provider. So there are many devices that are worn by patients that send vital signs to a nurse, a monitoring station, usually used by people recovering from heart attacks, for example, or that have medical conditions that need monitoring. Some disabilities require that because it's so difficult to manage the sugar level. There's also real-time telemedicine. Patients and providers use secure video conferencing software or platform to communicate and interact. By the way, I say this because I get asked by colleagues all the time. So what is it between what you have said, Dr. Badmus, and FaceTime, Skype, WhatsApp, even Facebook Messenger? Those systems are not built for tele. Why? Because requirements that the telemedicine system must have, and that's not why Mark Zuckerberg built Facebook for a completely different use case. So, what are the main benefits of telemedicine? Very quickly, it optimizes practitioner resources and can deliver significant cost savings. It delivers comfort and convenience, it reduces impacts and costs of distance. So you have a renowned professor in Nigeria interacting with his doctor in Australia. Hey, what's there not to like? And it minimizes the risks of clinic or hospital-acquired infection. It avoids or minimizes the restrictions or impacts of pathogens like the COVID-19 pandemic. Just as a matter of statistical record, Telemedicine has literally gone through the roof since 2020 because COVID-19 kept people at home or away from their doctors and healthcare providers, and people scrambled around to find solutions. And now that COVID-19 is kind of getting under control, people are saying, but actually, why do I have to go back to the doctor's office? Why don't I just continue to interact with him remotely? Beyond the pandemic, remote patient monitoring out of the high cost setting of a hospital. Believe me, I'm a doctor. I'd like you to come to a hospital because that's where doctors make money. But the hospital is not the best place for you. You really need to keep out of hospital if you can. One, it is expensive to have you in hospital. Two, it is dangerous because some of the infections people acquire in hospitals are the most difficult infections to treat. So as much as possible, it's better for people not to go to hospital. It ultimately improves patient health status. Some scenarios, it enables better assessment. It is possible to assess or to interact with the patient that is in Kenya by a doctor in Nigeria, including their relative in Canada. 3 different locations. That's only possible with telemedicine. Again, for now, there are lots and lots of challenges that people had when they wanted to select a telemedicine solution in Nigeria. Now let's talk about cybersecurity. This is the bit that most people do not pay attention to because they do not know about them. Now, what is cybersecurity? It entails the protection of electronic information and assets. Now, please pay attention to what I've just said, information and assets. I thought the information was the asset. No. The information is important, is useful. You can monetize it, you can commoditize it, but that's not the asset. The information that is stored in a particular location is the asset. If information is not stored, yeah, an asset. But it has happened, and lawyers in Nigeria are getting wise. They no longer look for ambulances to chase. Back in the day, they used to chase ambulances, but they now look for information breaches because it is a lot of money. Now, there are 3 broad objectives of cybersecurity in healthcare, but they involve something called the CIA of information, the confidentiality, the integrity, and the availability of information. If you can manage those 3 things, the confidentiality, the integrity, and the availability of information, you are protecting CIA of information. Well, that acronym because CIA also connotes or conjures up something else in people's minds. Now, cybersecurity in healthcare seeks to manage, mitigate, meaning reduce, or eliminate attack surfaces and attack vectors that are generic as well as those specific to the healthcare setting. So insecure emails and insecure communications platforms are vulnerable to what we call man-in-the-middle attacks. Essentially, it is that someone can take that email or that information, download it, keep a copy of it for themselves, make a change, a subtle change to it, and then pass it on. That's a man-in-the-middle attack, and it is a lot more common than you think. One of the rules I use is any organization, and I don't care, any organization that does not have their own bespoke, specific domain for emails, I don't want to interact with them. Why? Because that is so basic. It is so simple that, especially a healthcare setting, if a hospital is still using Gmail in today's, why? Because Google reads every email of the system. It's part of their terms and conditions. That is why, for example, a few years ago, I was traveling with my son. He had to catch, and we were traveling down the motor in the UK, and something popped up on his phone. You have 2.5 hours to get to the airport. And that was when it really hit me that every email in your Google mailbox, the Google AI reads it. I don't want my information to be read by Google. No. So the key thing is any hospital, I don't care how fancy the degrees of the consultants are. If they use Gmail or Yahoo Mail or Hotmail, I ain't going there. It's not happening because it tells me they really don't even know the implications of what is going on. Phishing. Phishing is when someone sends an email or sends you a text message or a WhatsApp message and says, oh, you know, I'm Zenith, I'm your bank, and we are locking your account today, now, if you don't do something. Now, click this link to sort yourself out. That's phishing. Essentially, they direct you to a site and you enter some information and they start from there. Eventually, if they are nice people, they only take your money. If they are not so nice people, they take over your life. So there are also physically insecure computer hardware. There are legacy systems. I know of hospitals, I've been to colleagues' facilities where they still use, wait for this, Windows 7 in 2022, Windows 7, for crying out loud. Now, that kind of hospital, obviously, I'm not going there for treatment. It's not happening. Why? Because even Microsoft has given up on Windows 7. So what are we talking about? So non-existent IT security culture, insufficiently educated or motivated staff, and patients that unknowingly, unintentionally compromise system security by what they do or what they don't do. Now, I need to mention this because I'm a specialist in how the human brain works. He's a psychiatrist, by the way. And we think that, oh, yes, insecurity cannot happen to me. I'm different. I can't get scammed. I can't fall for phishing attacks and all of that. It's called cognitive bias. It's the lies we tell ourselves, you know, about ourselves. So we think that we are actually rational actors, that we couldn't succumb to cognitive bias in cybersecurity, but year in, year out, month in, out, day in, day out, we otherwise. We suffer from biases like decision fatigue, hyperbolic counting, optimism bias. These are terms that we could spend the next few hours just describing and laying out the scenarios. But the important thing is that these are human weaknesses, and hackers are very, very good psychologists. They design their attack systems based on these weaknesses. So in addition to managing passwords, the password manager can also help manage cognitive bias. Let me tell you something. I live most of my life online. I have something in the region of 3,000 to 4,000 different accounts for different things online. None of them has the same password, not one. If I can remember the password, it is insecure. If I can remember it, it is not secure. It means somebody else who knows me very well can figure it out. Any password that you remember, forget it. If I spend time and energy, if there's me to get from you, I will figure out that password if you can remember it. A good password is a password that nobody can remember. neither the person that owns it or anybody else. Now, so the question is, and I get asked this question many, many times when I relate with colleagues, they say, but Dr. Badman, I'm a doctor. What's my business with this cybersecurity? This is another trick of yours to make me spend money. I said, well, yeah, you're right. If you want to do it right, you need to spend money. But the age-old description applies here. You think education is expensive, huh? You think so? Well, try ignorance. You know, if you think education is expensive, then try the opposite. If you think security is expensive, try insecurity. You'll be shocked at how expensive it is. Hackers view the healthcare sector as a target-rich environment due to the large amount of sensitive data that healthcare entities maintain for patient care and operations. So it meets two requirements in cybersecurity. There are large attack surfaces and there are multiple attack vector options. So the healthcare environment is particularly prone to attacks. Top threats against EHRs, for example, include phishing attacks, malware that lead to ransomware attacks, overlooked gaps in encryption, cloud threats, and Millennium Tech Services. We'll talk about cloud computing in a moment, and your employees. The human being is the weakest link in any security system. If ever there was a breach in security in any organization, if you look hard enough, you'll find a human being at the center of that breach, either deliberately or because of cognitive bias. They think, oh, it can't happen to us. We are so good. We are so fantastic. Nothing like that can happen in this organization. And all of that. And some email, and before they know what they're doing, they click a link, someone harvests their password, boom, game over. So, for example, in 2021, 20% of breaches involved compromised usernames and passwords. 1/5, 1 out of every 5 breaches. Ransomware can grind your operations to a halt, making care delivery and I'll mention a direct consequence of insecurity in a second. Ransomware payouts and the efforts to protect or harden healthcare systems and cyber defenses will increase your operating expenses and adversely impact some lives. Once you think that a healthcare facility has been attacked, that they will give you this and go away. That's not how hackers operate. They come back because during that first attack, they would have created a back door. And so, and they now make you pay very dearly. Security breaches that become public and ruin personal and organizational reputations, sometimes permanently. Compromised data security or threats of it can present a credible path to blackmailing a healthcare provider. Can you imagine a hospital that backdoor to their system and tell them, guys, we have downloaded 5 gigabytes of information about people. You got it? Here is a PDF of some of your prominent patients' information. Now, if you don't want this to go out to TA or Channels TV or something, we won't ask for much. It's just 1 Bitcoin. You know, we don't do Bitcoin. How do we get Bitcoin? Well, oh boy, that's your problem. 1 Bitcoin, send it to this address, and we'll keep quiet. And when they get broke, they come back and say, hey, okay, you remember that time? There is more information that we have, but we are happy to keep quiet. And so this blackmailing can go on forever. And it can cost a lot of money. And it is costing a lot of money, not just abroad, but also in Nigeria. But you don't get to hear because, hey, the whole point is to keep it quiet. Of those health systems experiencing the four most common types of cyber attacks, which, we said phishing attacks, malware, encryption issues, and problems, 20% said that they have subsequently experienced increased patient mortality rates. In other words, 1/5 of those facilities had more of the patients dying than needed to die. So this has direct consequences. And that is why governments in other parts of the world are interested in cybersecurity in healthcare. Because people are dying, it's costing lives. So it's something that our own government in Nigeria needs to look at. Is a cybersecurity report this month, September 2022, had some sobering statistics illustrating just how commonplace network attacks have become. The study found that 89% of surveyed organizations experienced an average of 43 attacks in the last 12 months. 43 attacks in the last 12 months, almost one attack per week. Equipment vulnerable to cyber attacks include insulin pumps, would you believe, intracardiac defibrillators, mobile catheter, mobile cardiac telemetry. These are extremely specialized things used for certain types of treatments, pacemakers, intrathecal pain pumps. Now, why do I mention all of this? Because people think that it is only something on a laptop that is vulnerable. No, there is what is called the Internet of Things. A lot of devices connect automatically, unknown to you, to the internet. And once that happens, they are open to attack. Research has found that an average of 6.2 vulnerabilities per medical device, and 40% of those devices are at their end of life stages. Basically, it means that if you're a hospital and you go on and buy obsoleted equipment from Singapore, from the UK, from America, where they may be cheap, but they are end-of-life devices, and hackers know exactly how to hack them. So there are costs. Now, who pays for lack of cybersecurity? One, the healthcare organization. They pay through reputational damage, through litigation by patients and other governments, other organizations and government agencies. The regulators can sue an organization for lapses in their security. And it is extremely expensive to clean up after data breaches. The medical practitioner pays personally or via their insurance company through the damage to their reputation, litigation by patients, and severe psychological trauma. Many doctors have been known to seriously think about taking their own lives when the stuff hits the fan, as they say. So patients also pay because cleanup of data costs money, and that cost is passed on to patients in the bills they pay. Medical systems may be unavailable, which may increase the sickness or even the rate of death of the patients. The healthcare ecosystem in general pays because security breaches, especially the ones that are widely publicized, can dampen confidence that people have in the healthcare system. So, and that can take a long time to rebuild. Compromised and therefore unreliable data can facilitate poor public health policy making. Now, we have a number of solutions. I won't go into all of this now because this is not a sales pitch. Normally, I will say a lot of this to doctor colleagues, but this is a different setting. Now, the the important point here is that for anything to be meaningful to a healthcare professional, it needs to be up to date. It needs to be localized, Nigerianized, if you like, and it needs full of or imbued with best practice, international practice. So once a system has that, and I know for a fact, because I know colleagues that use it, as that. So I will mention handheld devices because we are all mobile these days. We are very, very mobile animals now. Doctors and nurses use handheld devices to record patients' real-time data and instantly update the medical history of those patients. They make the handheld devices make more accurate and more efficient diagnosis and treatment more easily achievable because by definition, they are mobile devices enabling mobile healthcare delivery. Now, I will round up by describing the state of health informatics today. Basically, it's like a snapshot of where we are in health informatics. Health informatics interfaces can be confusing to the average healthcare practitioner, and more often than not, more time consuming than paper. This is a big issue because a lot of doctors, even the ones that are young, would you believe, medical training has not kept pace with health informatics. Even in the UK, in the US, in Europe, it's still a struggle. Yes, the environment is much better, but where the human brain thinks, essentially the brain is an analog device. That's the problem. The human brain is an analog device. In fact, you don't have one brain, you have 5 brains linked together, and they don't all do the same thing. So because of that, interfacing with anything digital is always going to be a challenge. So it's not surprising that health informatics also suffers from that. Despite all the innovations in software capabilities, interoperability between the various systems is still not even. So, for example, you have in a large teaching hospital, their radiology system is necessarily seamlessly linked with their diagnostic system. Neither is it seamlessly linked to their laboratory system. You see, different departments still operate more or less in silos, in their own compartment. That's a big problem because the demands on healthcare these days is that everything must happen seamlessly and in real time. Healthcare organizations are investing in data tools, that's a positive, to lower costs. And that's because it helps them improve outcomes and also to deliver on the mandates that they've been given. For instance, government might set delivery targets for the healthcare sector. Now, other things that describe where we are today. Healthcare organizations are shifting from data centers to cloud-based computing. Now, this is extremely important because back in the day, it used to be that if you wanted a decent computer system, you had to buy big hardware. You needed to buy a big server, put it in your basement somewhere out of reach, and all of that. It's no longer necessary. This is 2022. Cloud computing is where things are, and there is nothing that cannot be adapted for that purpose. Even Google, all the big guys are doing it. That's where they make money now. Microsoft 365, cloud computing. They're not. How many times have you gone to Computer Village to buy an office license? You don't need to do that anymore. just buy a cloud computing license and that's it. You are good to go. Connected devices are improving real-time data availability and information sharing. But here's a caveat. But the Internet of Things in healthcare devices is routinely targeted by hackers, and the technology still has a long way to go, especially in the security space. Although health informatics has been structuring data, healthcare organizations are accessing and manipulating that data in unstructured ways too. Why is this important? Perhaps a question might come up that will enable me explain that a bit more. But there is structured data and there is unstructured data. All of this gets pulled in big data, and the ability to manipulate it, to analyze it, to retrieve trends from it is the future. A few while much of the focus has been on technology used by clinical side of health, major functions, including billing, financial applications, and physician billing have also been automated. That's a good one. Emerging opportunities in healthcare innovation have mostly been driven by big data. These advancements are expected to drive innovation to reduce errors and disease management, both on small and large scales. The rate of adoption of health informatics by individual organizations and practitioners is a significant issue for the reasons that I mentioned, that the human being, the human material, the human brain is analog. The human brain is not digital, it's analog. It is relational. It relates everything you experience to everything you have ever experienced. So it's analog. And that's why there is this distance to anything digital. So I have gone through a lot. I came them deliberately because we just don't have the time to go through everything. The important I think then to be a part of the future, there is information, and then there is question and answers.
We can clap for him, you know. We're not going to reach out for that. Thank you very much, Doctor. We're going to take the questions later on, so that will force people to stay. I hope the online people are able to capture everything in the spirit of saving time. Without further, just get the next presentation on. I don't know who's leading it for helium. We said yes, that will be in the next presentation. So in that way, we can quickly link the theoretical aspect done by doctors to the application by seeing the providers of that. So very welcome to Helium Health. Yes, to Helium Health.
Good afternoon, everyone. My name is Olaoluwa, and I'd like to say a big thank you to Professor and also to Dr. Badmos. You've done an extensive work already, so you've made my work much easier. I'll just wait for the slide to come up. My name is Olaoluwa. I'm country manager. Country manager for Helium for Nigeria. And in the next 10-15 minutes, I think Prof has already talked a bit around the things that I'll want to talk about. So this will be more around what we do at Helium and how the electronic medical records is also helping a lot of healthcare facilities in Nigeria and all across the globe. So quickly, I think Prof has already said a few things around this, but it's also good to note that medical records from the analog to the digital is becoming something that that is catching up in Nigeria and all across the world. And for many organizations, it's access to patient files, like you would know. Ordinarily, sometimes patient files are missing. You have to wait for a long time before the file. If you belong to a particular HMO, they need to go check the stack of cards before they can find that. Some files, some paper files get missing even in the file sometimes. So one benefits of EMR is that it gives facilities access to a lifetime medical record. You come this month, you come in another 6 months, your record intact is there, live and direct. We've also seen that it helps a lot of facilities to improve revenue. If you ask the average medical doctor, say, or the medical director of the facility to ask exactly how much they make month on month or on a quarterly basis, many of them are only giving you guesstimates. One of the things that we've seen that EMR will do is that it gives you accurate information, whether the patient is paying cash, whether they're paying using the POS, whether they're paying using a transfer to the hospital's bank account. The EMR is able to capture every pathway that the revenue is coming from. So it helps facilities also see revenue. And I think Dr. Badmus has spoken about the bits around data. You can start to see even specific clinical areas where you are getting the most of your revenue. Are patients going to the lab more? Or are they going to the radiology more? Are they doing CT tests more? Are they talking to just GPs or specialists? So it gives access to those insights. What kind of clinical areas do we operate within the facility, and which specific ones are we having the highest numbers from? Patient satisfaction, in terms of medical errors, it's reduced to a reasonable extent. Sometimes even the pharmacist can't read the handwritings of a doctor sometimes. I think it's something to learn in medical school. So that's on one part. So there's a medical error, there's a waiting time where I can get into a facility by just asking for my name. The front desk person can quickly access my data, schedule me to take my vitals and schedule me to see a medical doctor. So it also improves patient satisfaction and operational efficiency around the hospital. You know, if you are low on the particular medication, something in stock, it's easy to be able to know. You can see everything across board. Helium Health is Africa's #1 EMR provider. We have offices in about 9 countries. We are in Nigeria, Ghana, the GTC region, which is Oman, Dubai, and Qatar. And we're able to handle every kind of healthcare challenge that we are seeing in facilities across Africa. Our software is able to manage operations, to do a lot of customizations for facilities. We know that even though there are standard procedures within every facility based on WHO standards, we know some hospitals will still make a few changes here and there. So our EMR is also to make those customizations for them. So the question people always ask us is why Helium? And I think this would answer that question. First is that we're able to onboard new facilities in 14 days. I mean, 2 from when we start to, once we sign up a contract, we're able to access your facility. We can get all the information we require in 14 days. We're able to get you live. And then we have very advanced functionalities. Like I've mentioned, some facilities will say, we want to be able to do this and do this and do that. Our facility is also able to give them all of that customization. And then for those who want to also automate their hospital workflow, we're able to customize that as well. And then analytics is very important. And I'll go to the point where we're talking about also access to credits. We have different products at Helium, and one of those is Helium Credit. We see that access to finance is a major challenge for many, even hospitals, diagnostic centers, pharmacies. You have to go to the bank is asking for collaterals. Now, for us to be able to give you credit at Helium, because we have a healthcare financing product, one of the things we are looking out for is your data. To see how many patients you're seeing in a month. We want to see how you're making your revenue, because that gives us confidence of repayment. System gives you that real-time access to the performance of the facility and the data touch points, which I think is very, very critical. And then we have a very strong support system. So we have remote support. We can also offer physical support in cases where those are required. And in terms of revenue, I think leaks are able to be plugged. You are knowing where your revenue is coming from. So nobody is diverting revenue to anybody. A patient comes in, he gets medication, there is a bill for that. It goes to the laboratory, there's a bill for that. So we're able to monitor everything across the patient throughput within the facility. So some of the features we have, I want to go in depth. So I'll talk about billing, because I think this is something that is very critical for every healthcare facility. So one is that you can channel process across multiple channels. I've mentioned that already. Whether a HMO patient, you are out of pocket patient, we're able to know who you are. So even if you want to do your claim submission back to the HMO, for example, a patient comes in, you've attended to the patient signs off before the leave. We can help. Our system is able to allow you as a healthcare facility to submit your claims in real time. There's also the place of capitation management, even for HMOs. Our software is able to integrate with a couple of accounting software. So from Sage to QuickBooks, depending on what the hospitals or diagnosis centers are also able to use. So we'll now give you the insight to your financials, and then you can also set your tariff. So if you want to charge 1,500 for maybe malaria test, you want to charge 1,000 for another kind of test, you can start to set those tariffs there. So you can make changes. So it's very flexible, allows you to make those changes. So let me talk quickly around administrative bit, because we know that EMRs are majorly built for the clinical bits. Many people don't talk about the other bits of the EMR. So looking more around the billing, and I'll talk about the administration bits. Dr. had already mentioned that people should have different access to patient data. Somebody who sits at the front desk should not see your last medical history. They can see maybe the last time you came into the facility, but they shouldn't be able to see the medical notes. And that's where the place of decision comes into play. The workflow within where do you start? Are you going to the nursing station first to get your vitals done? From there, are you moving to see a clinician? And then maybe they're moving you to go to the laboratory. So this also to monitor the workflow within your facility. And in terms of management, we're responsible for what? So we create different levels of access, and that also shows maybe somebody needs to see something. I need to prompt you to get that data. For example, I'm going to use an instance. Somebody takes a test in the laboratory, for example. That result is needed for the doctor to check the outcome of your lab investigation to determine what diagnosis he needs to treat. And that's a place where team management starts to come in place. You can also see your staff profile, who has access to what and who doesn't have access to what. So who logs in at what time. So you can also send the report to the patient if they would like to have access to the report. So let me just keep this. Team management is first in, first out, who comes first and who gets the results, or who sees the medical practitioner. And even for the warehouse, this talks about your stocking of your medication, stocking of every other consumables within the facility. So our deployment process is very easy, like I've mentioned. So usually we start from the point where we're having our project kickoff meeting, specifics with respect to what requirements within the facility, what kind of information do you have, how is your team structured, and then we start to review to say, does this fit what your business needs? Because we try to ensure that we customize as much as we can. And then we move to the point where we're doing our site assessments. Do you have the maybe internet? Do you have the laptops or the work tools that are required? Because this now is driving on devices to make it happen. EMR can be on-site and be cloud-based. So depending on what you would also require, is what we do within that point. We are checking the scope of work before we move to configuration bits and deployment. We are setting up the facility, setting up everything that you need within the facility. We're also ensuring that the users that are going to be made use of the systems are able to test to be sure that this works for them. We won't just dump a system and leave you on your own. So we also ensure that we're also training your people to ensure that have hands-on to be able to use the system. And we go live. And I think just what happens after that is support. Because sometimes for many facilities, this is new. I want to ensure that you have all the support all the way until you can go on autopilot. We have about 500 facility, about 8,500 practitioners who are that are using our softwares. On the average, we see about over 300 patients every month on month. And like I mentioned, we operate in about 9 countries at the moment. In terms of impact, we've seen that efficiency always improves by at least 40% in facilities that we have gone to. So we check what they were doing before we came, we take notes, we ask questions so we can document, so that 3 months, 6 months down the line when we come, we are seeing that there's a lot of efficiency in terms of your operational processes. Also for revenue, we see that revenue also grows significantly because there are many loopholes now that the EMR is able to help you to plug. We see reduction in patient wait time by 35%. Now you can come in 10 minutes, you can see a doctor. If you're not seeing a doctor, there must be a reason why you're not seeing a doctor. It shouldn't be that your file is missing. And I'm sure many of us here, we've had experiences where you came in. I have an experience very recent. I was at the facility on Friday and I had to go back on Monday. They couldn't find my file for like an hour or two. I think they left it at the lab. And that was the last point when my file got missing. And it took almost 2 hours to find that. So we see that it also helps us in terms of waiting time. Medical errors by 95%, prescriptions, dosages, sometimes you see medical overdose. I know there's always there's a lethal dose that you can't go more than this. But when a patient starts to go over the right medication, that can also impact on the health of the patient itself, or themselves rather. So a couple of clients with, and they're very notable brands. So from Paylon to, so I know many people know South Shore. We have Cedar Crest and Gariki Specialist Hospital. These are Lifeline, a couple of facilities that are notable in Nigeria that we work with and even outside of Nigeria. We're also in Kenya. We have support from many best in class in terms of industry investors that are under industry leaders. We're working with the Lagos State government, we're working with the ICT state government, we're also working with the Akwa Ibom state government. So these are big projects that we're also helping state governments also digitize the healthcare system in those states outside of the private sector. So the that helps patients to be able to book appointments. We know this is new, but we're already doing this in Dubai and Qatar. Now, what does this do? It gives the patient now the opportunity to determine when they want to come to the clinic, what specialists they also want to see. And many times we go to the hospital and they say this doctor is available, and that's the choice you have. Maybe it's the orthopedics clinic day, and it's a Wednesday. It's between 2 p.m. and 5 p.m. So if you miss that time, and that's it. Now, what our Helium Doc is going to help patients in Nigeria, because this is a new product we are launching in Nigeria. It's already operational in UAE and a couple of other countries, is that you can see a list of hospitals, see a list of specialties, the consultants, the clinics where they are at that lab point in time. So if you prefer to talk to Dr. Badmos, for example, and maybe he's at, I'm looking for, maybe it's at Reddington on Mondays, and maybe it's at Reddington VI on Monday, and it's at Reddington Ikeja on Wednesdays. You don't want to drive to the island because you're on the mainland. You can book to see Dr. Badmos specifically at Ikeja, Reddington on the Wednesday. So that's what it gives to you. It also helps the hospitals to get some kind of ratings. So based on patients' experience, satisfaction, the way you would rate a Jumia, for example, when you buy things, you can rate the product, you can rate the vendor, you can rate the app. It also gives you the opportunity to rate, and it does some form of analytics. So it gives you the opportunity to find the best doctors in Nigeria. And so for the hospitals, it's that bring more patients to you. If you would like us to work together, we can talk around that. And then there's also the enhanced patient experience. You don't have to call the contact center of the hospital. Sometimes they pick up. So we just want to make life for the average Nigerian who can afford it. And we know it's just the consultation fee. Everybody pays that anyways. And then it also is your reputation. Many people are rating your clinics online in real time. So I can just go on Helium Doc. I can search for your facility, and I can also see the rating. If it's a 1-star, I'm definitely not coming. But if it's a 3-star, 4-star, it will help you to be able to push your rating and your reputation up. Now, I think I mentioned it already. See this slide now. I already spoke about this. So we also have the Helium Wallet, which is integrated into our EMR. Now, what does the Helium Wallet do? Is that it helps you to be able to have collections from every touch point. So if the patient is paying cash, even though it is cash, we want to be able to record that cash and make sure that as the patient pays, the EMR also takes that into cognizance. If it's a virtual bank account, we can also integrate with that. So we work with many fintechs to be able to make this happen. We have the POS option as well, which is also integrated into the EMR. So it makes the billing seamless, reporting much better and easier, and then it gives you transparency. It also improves liquidity of many hospitals, because many times the cash is missing. You don't know where it's gone to, but now it gives you transparency and you can see better liquidity. I think I spoke about this, and we see that now we're able to offer up to about 50 million naira to medical facilities. That would be hospitals, laboratories, diagnostic centers. Many of them have issues accessing cash and capital. So what we are doing is we are helping them to have access to working capital, working finance. You could buy a device, and we'll always work with the the company where you're sourcing the device from. We do fixed asset financing. If you're trying to open a new facility, we can also support you with that. If you're trying to get an invoice discount, we can also work with that. So we're happy to talk. I have my team here. And in the next, I think, so this is our leadership team, okay, Tito, Dimeji, Ralph, who couldn't be here because he's away on leave, Chichi, Dami, and myself. So we have the team. And quickly, my colleague Uchenna will be showing us a practical example of an EMR, how it works, so that we can put practicality to this. Thank you very much for your time.
Thank you very much.
Can you hear me? Yeah. Okay. I'll be giving you a live demo of how the Helium software works in a facility. So this is our Helium Health platform. Yeah, sorry, it's connecting me to Okay, so this is our Helium Health platform. Extremely secure. We secure the data with a 128-bit SSL data encryption, right? And the security is based on access level. So only individuals in the facility that have been given access, even within the system, have access to whatever is within the system. So we can log in with either our phone number and an email. And as soon as we log in, the first thing we see is the patients tab, where we can see the recently seen patients in the facility for up to 3 months. So you will notice that the last patients that came around was on the 14th of September at 12:41 p.m. So seamless usage of this software. To find a file, so as if I am a patient and I've walked into the facility and my name is Uchechi, all I have to do is go to the search tab right there and type in Uchechi. And as soon as I do that, the name will pop up and we don't have to go around looking for a file, right? And as easily as that, the file can be forwarded to the next of care. But for new patients, we have the registration tab right here where we can register a new patient. The personal information can be collected. The billing information can be collected because some patients pay out of pocket, right? We regard them as private patients, and while some are insurance patients. I don't know if any of you have HMO coverage right here. So you could, for facilities, they have insurance insurance tariffs as well. So we can click and register. So let's register and check in the patient to see the next point of care. So we can still confirm, and this happens at the front desk, right? So what's seen is the general scope of the software because I'm logged in as everyone and I have to show you the entirety of the software. But actually, because of security, not everyone should have access to everything. So if I'm a front desk, this is all I can do or whatever my job description is, right? So I can specify as a front desk what insurance provider, what type of visit. So if this is the first time visit or general consultation, all I have to do is click on visit type and write consultation, and we will see the different kinds of consultations that we offer within the facility. So I'm going to just select start consultation, which is the first option, and you see the prices automatically there. We have appointments there. If there's an appointment already existing, so for example, this patient has come and we booked an appointment. If the patient is returning for that appointment, we'll be able to see it in that appointments tab right there, but there's no appointment, so the option. So I can select what particular doctor this patient is going to see. If it's a team, maybe a general case, any available can see, I'll just click on team and just put doctors, right? But for this one, I want this patient to see me specifically. So I'm logging as Dr. John Doe. So I see a drop down of the doctors available and I can select John Doe. For facilities that have multiple specialties, right? We will have all their clinics. If they have antenatal clinic, if they have GOPD, this patient is acknowledging that he or she is informed that his or her file is being stored by this software. We can check in the patient to see the next point of care. Right. We can from his name open his patient's file. Now, the file can be forwarded to the next point of care with this forward button right there beside submit new entry. Right up there, besides submit new entry. No, this the share button, yeah. So the file can be forwarded to the point of care. So all I have to do is just type in whoever's name I want to forward it to. So I can type Dr. John Doe. Just put John Doe. Yeah, so it's already even telling me there's someone on my queue. So I can click forward and add to queue. So this is part of how the software manages queues to ensure that first comes, first serve is observed. So once that happens, a notification is sent to the doctor, which I can click, but the file is already opened on my system. So this is what the doctor sees. If this was a returning patient, some information will already be on the patient's file. So we have at the right side of the screen with the patient summary, where every updated information is stored at that part of the screen. So at a glance, a doctor or a medical practitioner see the updated and the recent information of that patient. So we can see the blood pressure, heart rate, body temperature, and as we continue to enter, make entries into the patient's file, it's constantly updates. But at the left side of the file, we have the timeline where every individual entry is right there. So what the doctor or the nurses do to click on that button, submit new, enter vitals. With that button, we make any entry we want to into the patient's file. So could you kindly click on submit new entry? Yeah, so with that, we can enter vitals, medical encounter notes, everything. But like I said, we only have access because this is a demo, but in real life scenarios, not everyone would have access to all of these based on security and confidentiality. So what, as a doctor, what I'll click on medical encounter notes, we enter a medical encounter notes, and I'll use one of our templates. So I'll just go to general practice, the fourth option, no, below, yeah. And I'll click on new initial visits below, yeah. No. The fifth option, yeah. So this is the template that we use for, I'll click on proceed to notes, yeah. Thank you. So this is one of the templates that we have. You can go ahead and enter the complaints. So if the patient says, I have a fever, all I have to do is type in fever, and you will notice that options are being suggested, and that is because we want to that data is accurately collected. We have a data library embedded in the system called ICD-10. I think the doctor spoke about it, ICD-10. So if the patient says I have headache, all I have to do is as well type headache down. Yes, so based on the patient's complaints, as I scroll down, you will see the other things, the other patient's history that I can collect. So could you kindly scroll down? Yeah, so I can enter the drug history. Continue scrolling, please. I can enter the past medical or surgical history. As we continue to scroll, all of these patient history can be collected, right? Please scroll also. Yeah, and even right from this note, to ensure that time is saved, please keep scrolling. Yeah, thank you. So to ensure that time is saved, we're able to do other things even within the consultation. So I can decide to prescribe. So all I have to do is prescription, and another window will be opened below for me to prescribe drugs for these patients, because sometimes the doctor already knows what is wrong with the patient, right? So, and I want to prescribe drugs. If the patient says, okay, I'm already having headache, constant headache, so I know this patient has to take paracetamol. So all I have to do is select the particular pharmacy, because for some larger hospitals, they have more than one dispensary. Maybe they might have a dispensary for their dental clinic, they have another dispensary for their eye clinic, they have another dispensary for their general clinic. So all I have to do is select what pharmacy I'm using. So I'll select the main pharmacy, right? And all I have to do is either use the brand name or the generic name to prescribe. So I'm using the generic name. I'll use paracetamol. Yeah. Right. I can specify the dose to say, okay, I want to prescribe 2. The route, is it by mouth? I can specify what route. Is it by mouth, per rectum? So I'll say it's by mouth, the first option, and frequency, I'll put frequency, I'll make it 3 times a day, which is TID. Yes, and I can specify how many days I want this patient to take it for. So let me say 3 days. And I can even go ahead to request for clinical investigation. So if I scroll back up, yeah, I can still request for clinical investigation to say, okay, I want this patient to do a full blood count right there beside the referral. Yeah. And I can scroll down back, yeah. Scroll. Yeah, so I can decide I want to run some clinical investigation. And as I select those clinical investigations, they're automatically billed for. So I'll just type in the clinical investigations to say full blood count, and you see the option to select the full blood count, right? I can also do the first option, yeah. I can also say I want to run malaria tests. So all I have to just do is write malaria, right? And you see all the tests that have to do with malaria. But for this one, I want to run the last option. So scroll down more, please. Scroll. Push it. Yeah, the parasite test. No, second is the last one, yeah. And I can go ahead and submit this encounter note. And automatically the prescription orders and the lab investigations will be automatically sent to both departments. So if I go to, so automatically the lab will get the investigation request, right? So could you take the cursor to the left, to the right? To your right, take it to the far end. Yeah, so let's go to lab. Yeah. So we can see Michael Ogunkome's request is awaiting specimen. So the patient can go directly to the pharmacy or to the FLEB where the sample is being collected, and I can click on, so what the lab scientist does is click on expand, or whoever is collecting the sample is to click on expand. And once that sample is collected, we can specify what sample is being collected. Is it blood? And if it's on that option, you will see the wide range of samples that we can specify that has been collected. So we have the option of tissue, blood, urine, specimen, and everything you can see right. And once the sample has been collected, I can just click on take specimen. Yeah, and the entry has automatically been updated, right? So I can, once the test results are ready, I can go ahead and click on expand again. And this is done by whoever has run the test and is entering the results. and can specify, and this is just for the malaria parasite test, right? So for every of the tests, we can specify the results. So can you just kindly click on the option beside malaria parasites? Yeah, so we can specify what the extent of the malaria infection. So just click on any of the options, please. Yeah, we have this notification, notify patient button right there, which ensures that once these test results are submitted, the patient is already is notified his or her results is ready. So once that is done, the patient will get a text and an email. So please just click on submit results. Yeah, so this is what happens at the lab. While at the pharmacy, could you kindly click on the pharmacy tab? While at the pharmacy, before the patient gets to the point of the drugs being dispensed, this is what is being done. If it was with paper, this is when the pharmacist will be picking out the drugs and counting them. But in this case, it's automated, right? So once all the pharmacist has to do is click on expand, right? And we can see the doctor prescribed paracetamol, we can see the frequency, the dose, and you can see the quantity is already automatically calculated. So all the pharmacist has to do is click on select option and type in paracetamol, and you would see the available paracetamol within the facility. And you can see that we already know how many is left in the inventory that is left in stock, right? You can see it's more than 1,300. Right? And we can now specify what batch this particular drug is being prescribed from. So this is how our software is able to plug leakages regarding your inventory in the pharmacy, right? And I can go ahead and submit bill. So we can see that it's already calculating the outstanding balance for the patient, which is up to 13,700 naira, right? So you can see there's still an outstanding balance. So the pharmacist will not dispense this drug until the bill has been cleared. So what happens is that the patient, many times if the patient has to pay out of pocket, or even HMO patients, they'll have to generate a claim form, right? So what happens is that they go to the cash points or the billing point or the HMO office, depending on how the facility runs. And those departments work with the tab called finance. So could you go to finance? Yes, so this is the finance, interface, right? Where you can see all invoices, and we can see Michael Ogunkomi has 2 invoices, one unpaid and one open. So what the whoever is managing this cash or billing collections does is to click on pay now. And we can see everything that this patient is paying for. And because this is a private patient, we only have the option to clear it based on the private bill. And we can decide, okay, is this patient going to pay the full balance? Is this patient going to pay partial balance, depending on the facilities policies, right? But for this test, we're going to click on pay full balance. Yeah, and as we scroll down, we would see the different media of payments. So we can pay, you can collect this payment through POS, bank transfer, cash, credit balance. If it's POS, all we have to do is specify what POS the payment is being collected with. Bank transfer, we specify what particular bank account this payment is paid to. If we click on cash, all we have to do is to confirm that this particular amount was collected. But for POS device, let's just select the particular POS device. Just select anyone. Yeah, we can now confirm that the transfer has been completed, right? And these receipts can be printed out and given to the patient. So this is the receipt. Can you go to the receipts? Up a little bit more. Yes, so we have this option button right here where we could actually mark as error to say this bill was not cleared properly. We can report and the doctor to say, okay, this patient actually paid to give to the patient. So just click on print to see how the receipt comes out. So we can print out either a full printer and A4 color printer, these short thermal printers that print in POS receipts. So while I'm short, once I click generate, we'll see a template of how the receipt looks like. So yeah, you can see the name and the logo of the clinic, the address, information of the patient as well, and the description and breakdown of everything that the patient is paying for, and it says thank you at the bottom. So just click on cancel so we can go back to the, yeah. So this is basically how the patient journey goes. And once this is done, once the patient goes back to the pharmacy, all the pharmacist has to do is click on dispense, right, to document that this drug was actually given to the patient. So based on our data on data management, right, and how it efficiently collects accurate data to make informed decisions within your facility, our software gives reports, right? So we have insights, yeah, where the facility generates summarized reports for decision makers within the facility. Like I said, not everyone has access to everything within the system. So this is solely for decision makers, right? So we can financials, how much has been generated within the period of 1 month. So for all the reports, the default is for 1 month, right? For the present month. But we can always click on that button that says this month to filter for different periods of time. So I can tell to see reports, a summary of this week, last week, this month, this year. So basically, and even a custom range from one particular date to another particular day, but let's just use this month, right? So let's leave it as it is. So yeah, so for revenue, we can see 1.8 million was generated in this facility, right, which is 100% growth from previous months. We can see that the category is 4% for HMO, 96%, but this is not accurate data, right? This is a test site, so this is just for demo. You can see 25 transactions were carried out to generate this revenue. We can see our top earning services for facilities to make a more informed decision. In fact, there was a facility that realized that with our software, they were seeing a lot of antenatal patients, and they were like, why not, let's go ahead to have a mother and children's clinic, right? And right now they have about 3 branches, I think. So you can see that procedures make 88%, drugs make 6%, lab investigation make 3%. We can see our top earning HMOs, which of our HMOs generate the most revenue for us. And as we scroll down, it doesn't just give financial reports, it gives reports based on your patient visit. So this month we've seen 26 patients, which is 26% lower than the previous month. We can see our total count of files within the facility. We've had 14 new patients this month. We can see our top diagnosis. So we can even use this for research purposes. We say, using my facility as a case study, we experience mostly skin changes due to chronic exposure. This is a test, so this is not, please remember this is a test, right? I can also see that 14 weeks of gestation pregnancy is what we is experienced most of the time, and using this facilities as a case study within this locality, right? We can see our top prescriptions, paracetamol. So we won't be stocking up our inventory with normal saline is the option, with, let's say, ibuprofen, right? When we see that what we prescribe most of the time is paracetamol, right? But this is a summary, right? We have a wider range of reports in reports, the next tab. So we can see this now gives a wider view on your appointment. We can see we've had 22 appointments, which is, scroll up please a little bit. No, up, back to, yeah. We can see it's 21% lower previous month, and these reports can be downloaded into an Excel file right there, right? We can see inpatients, we can see reports on in-queues. So just scroll through the tabs at the top so we can see how those reports look like. So inpatients, yeah, we can see reports on inpatients, we can see reports on in-queues. Yeah, we can see our mortality rates. We can see pharmacy. So for in-queues, like Olaoluwa, who presented before me, said, right, you're able to manage in-queues. You're able to manage your patients' wait time, and we've noticed that we've been able to reduce patient wait time significantly. So you're able to even manage it. So how long did Michael Ogunkomi wait for? Throughout all his period within the facility, we're able to see that he waited for just 5 minutes, right? And that is pretty impressive, right? So that was the time he spent sitting down without a medical practitioner attending to him, right? We have mortality rates to know, okay, are patients even, are we really treating patients? We can see pharmacy, stock in against stock out, right? And diagnosis, which is very impressive for me. You can use this to say, okay, for this year now, using my facility as a case study, what is the prevalence of malaria in the locality of Surulere among children from 0 to 15 years? I can actually get that data using this particular software, right? So these are some of the medical reports you could actually spool from having to use a medical record software, right? But for financial reports, what I have to do is go to finance. For financial reports, just go to finance, right? And I can see reports on invoices, right? Even for passive patients, I can start to search for Michael Ogunkomi's name to see all the invoices that have been generated for him, right? In case of, just for record keeping purposes, I can see payments, all the payments that have been made within my facility. So just click on the tab, payments. Right, so I can say I want to filter by deposits to see all the payments that were made through deposits. I want to see all the refunds that have been made. I want to see all the cash collected, all the bank transfers that have been made, all the POS payments. So I can basically see how all the payments came in, payments that have been made in, right? But and we can even manage our claims. So for facilities that work with insurance providers, HMOs, we are able to, because sometimes in some cases, right, they lose track of how much is to be collected by these from the HMO. So we can see I have 11 claims that have been submitted, that have not been submitted, right? They're just lying within my facility. I can see that there are 75 claims that have been submitted, not paid for, and I can see the words, right? And I can see those that have been submitted and paid for within the last 30 days. But for the general financial reports, to know how much we're generating from each aspect of the facility, I can click on reports. Yeah, and I can see, if you scroll down a little bit, you see the total of everything that has been generated within the facility for this month. Like I said, the default is for the month, but I can always filter to say, okay, I want to see for the year for different durations of time. Please scroll up a little bit. So if I say I want to know how much we are making through radiology, all I have to do is click on radiology, or if I want to see how much we are making through vitals, or basically all I have to do is click on it, right? And it pulls up or it pulls out the particular amount that we're actually making. So for example, this helps decision makers informed decision, right, based on data that has been collected over time, running the software in their facility. And I can also download a revenue report. If I scroll up, yeah, I can download the revenue reports, and I can even break it down by 3 parameters. Click on it, please. Yeah, I can break it down by 10 parameters. I can break it down by clinic to say for multi-specialist facilities that provide more than one specialties. I can say, okay, I want to know which of my generate the most revenue for me. Is it just general practice? Is it anti-radiology? So we're able to even break it down by clinic. We can also break it down by patient to say which of our patients generate the most revenue, and even by doctor. And this is the way of rating the doctors within your facility. So these are just some of the features of our software. If we are to go into the nitty-gritty of this software, it might not be done by the end of today. But right now we will be entertaining questions if you have any. Thank you very much.
Thank you for the beautiful presentation. Now, I have once interacted with something like this, and I must admit that this is much more comprehensive than that. So my question is that some health facilities that are registered with your company. So there are some that are, others are not, just put it that way. Okay. Now, is there a means by which we share data between those facilities that are within your range and between those outside your scope. So let me just bring it a bit further. Now, supposing you have a patient in a facility A, which you have in the company, and the patient has, for a reason or the other, had to be referred to another facility, which is not captured in the company. So, and the person will not have to pay again for certain things he or she has done in the past. For example, he has done series of laboratory tests in the previous facility, and now he has been transferred to, say, a teaching hospital, and on getting there, of course, the request for some of the previous data. Do you, or let me say, does your company offer such service? You get my question at all?
No, it's all right. I was going to suggest that I was going to suggest that. So let's have Mr. Olufemi Joshua for the clouding. But hold on to the question so that we'll grab all the questions together.
No, good evening. Yeah. Good afternoon. Yeah, like I all see, my name is Oluwafemi Joshua, the CTO and the president of Millennium Tech Ventures Limited. We're a Microsoft partner company. We deal in Microsoft Cloud Solutions and other things that Microsoft does. Then what we are today is to talk about cloud solutions, cloud computing and edge management. Like you have had, I come in contact with Alien through my own hospital. I was discussing with the doctor many years ago that you need to authorize your system. We'll come there with a family card, they go to a rack, searching for your file and everything. But after a while, I just went back and I saw that the guy had started computerizing the whole system and everything. And I was shocked that from one table to the other, to the doctor and everything, it was fully computerized, even to the pharmacy and everything. So when we were coming up with this program, Professor is a friend and he was coming up, decided as a project coming up like this. And he said, and what can we do? I said, no, my hospital use a system. They have an AMR that they use, and let me just look for who and who bundle the system together or have the software. A dentist had difficulty to operate for about 6 months. Some were covered up with clothes because they have not been exposed. So right now, we've been hearing about computing, cloud computing for a long time. It's been with us for a long time. Our emails reside in the cloud and everything. But we are talking about cloud computing edge management. Helium system, they mentioned that you can have your system on-premise and in the cloud. The purpose of cloud is that you can leverage on the return on investment and cost. And the cost. You don't need to buy all the devices, the server, the UPS, because of electricity again, you want to buy inverter and everything. So all you just have to do is that we are computing everywhere, anywhere, at any point in time. So what is cloud computing in hospital management? Cloud computing hospital management describes the practice of implementing remote server as via internet to store, manage, and process healthcare related data. This is in contrast to the established and on-site data center with server hosting data on a personal computer, like I just said. So like I said, cloud computing to a layman, why like computer jargon is that it relates to things that you can see and you can touch and you know about. Some see it as if to some it seems as if it's abstract. So cloud, when you look at when you get out of your room and you look up, you can see the cloud. That cloud is all over the world at any point in time. So what we are trying to say is that when we cloud computing, wherever you may be in the remotest part of the world, you can communicate and do whatever you want to do. For example, we have hospitals in Dubai, we have hospitals in Nigeria. There are hospitals that are doing medical tourism and everything. Your file does not need to go with you when you are traveling. With Helium system that he has said, with a partner in Kenya, in Dubai, and everything, they just have to share the EMR. So the overview. Plus, storage offers a flexible solution that allows healthcare professionals and hospitals to leverage a network of remotely accessible server where they can store large volumes of data in a secure environment that is maintained by IT professionals. Yeah, you don't have to bother about maybe because year in, year out, you are generating a lot of records and you keep increasing all of, and you don't need to have an headache where you are going to warehouse your data and where you are going to store your data. So since the introduction of electronic medical records, mandates and healthcare organizations across the world have adopted cloud-based healthcare solutions as a means of storing and protecting patient record. Patient record is key. Like Dr. Fatai said the other time about cyber security and everything. There is no patient that wants his record to be shown to the whole world. There is no patient that wants his record even to be shared with a clerk in the hospital, because it's between there's a competition between you and the doctor. Your record, everything about you end up with the doctor. So according to business communication company BBC research, the global care cloud computing market is expected to hit an average of 65 billion by 2027 with an annualized growth of 18.1%. You can look at this. This is what we are talking about. And thank God, Nigeria as a whole, we are not all that, we are not doing badly at all. Like Doctor said the other time, thank God for Soludo when it came with CBN reform and everything and banking reform. It was so tough on those bankers and everything. A lot of head has to roll. But he said, we are going to recapitalize and we are going to do a lot of things. ATM machine has been all over the world or some part of the world, but if it came to Nigeria, it became a thing that everybody can punch his pin and go to the machine and withdraw. At the market now, a market woman can tell you, I want my money. I don't have cash, madam. Okay, do transfer. This is my account number. And guess the transfer. So easy. And so you might have a little network problem. That does not remove the fact that it's working and it's working perfectly. So we are advancing. So we are catching up and we'll get a long way. So it's an opportunity for you, those of you representing your hospitals and everything. The administrators are not here and those who are online. Take advantage of this. And we are going to have with this Roundtable today. We have an established relationship with Ilium. So if you come for this, if you attend this, there's an opportunity for you. If you want to liaise with, you want to sign up with Ilium, you're good to go. So what comprises of an healthcare cloud ecosystem? A key advantage of opting for cloud environment is that it's on demand and at scale. On demand is that whatever you want to use is subscription based. You pay per month or annual. It's like your recharge card. If you buy data for 1 month, if you don't exhaust the data, you can roll it over. So exactly as per specific business requirements. For example, if you are using Azure and you have your platform on Azure or anything, you can subscribe to what you think and consume. If you want to use for storage, for example, maybe you want to store your data and everything. If you know that you cannot consume more than 5 terabytes, you just pay for what you can consume and you start using it and you keep increasing if the need arises. What comprises of an healthcare cloud ecosystem? Cloud computing is the same thing, the same categories. The services are delivered on a continuous basis, a model selected IaaS, that's infrastructure as a service, platform PaaS, platform as a service, and software as a service. If you are familiar with Microsoft 365, all our office suites is now on Microsoft 365 with the Windows. Windows is now cloud. From Windows 10 is now cloud. And like Doctor said the other time, many of us, we are using outdated and clone operating system. Those who are behind it are in Asia with a very large, big offices where they are harvesting your data. You might not know. Peradventure, you are using it to transfer from bank to bank. A day will come that an hacker will get to your system. Right now, you don't need to go to Tigba to buy a CD that someone will help you to crack and use it on your server or your system. Microsoft 365 is available and every other, so you can, as well as is a subscription based, is a cloud system, a software as a service. And just what you pay is your annual subscription, and depend on what you want to do. If you are using Microsoft Office, you are using Microsoft 365, is per user base, and you can use it on many platforms or many devices. So we have deployment and model can vary from public operated for a large industry group or to a general public, private operated from one healthcare organization or an hybrid, combined public and private, allowing data portability among one or more cloud deployment. The three main constituents of this ecosystem, application, data, and services, are interconnected between the nodes of a cloud and allow anytime, anywhere access. I've mentioned that. That's the main thing that makes it cloud. Anywhere, anytime access. Before now, when you look at Microsoft, the way they work, India is awake at so period of time. Australia is ahead of almost everybody. Their offices are always there, all around across the world. If India is closing by 6 p.m. their own time, what they have done, they ship it through cloud to other engineers, software engineers to start working. So they work 24/7. So this, and you see some of this software, even our ordinary Microsoft Word, if you are using from 2017 upward, you can co-edit. That's just what I'm trying to explain to you. if I can co-edit on such thing on such platform, so it's easier when you do cloud computing. Like the young man who mentioned, who was trying to ask a question, with cloud computing, and you are connected with Helium system, you can ship anything from one hospital or one of the hospital or one establishment or to another. You don't have any problem. So what is healthcare gradually shifting to? Why is healthcare gradually shifting to cloud? There are some interesting dynamics that dictates why healthcare industry is willing to move to a cloud-based IT environment. One, there's an increasing need to conform to the regulatory compliance of HIPAA. HIPAA. I think HIPAA, Health Insurance. Doctor, can you help me? Yes. It's health insurance. Okay, don't worry with that. We can just Google it. Thank God for Google. So cloud computing is expected to assist in expanding the range and depth of care and clinic outcomes. Explosion in big data in this sector makes it better suited to a scalable and cloud environment. When we talk about big data, analytics is difficult. You can't do that with just what you have on your on-premise and everything. It's not going to be easy. Software has what we call Power BI. Power BI will help you in doing your analytics. So what data can be moved to a cloud-based environment? Some of the data that has potential to be moved to cloud development is immediately based as below. Pharmaceutical data, we have heard of all this. There's no need to worry about this. William has mentioned all of this. Type of cloud computing in healthcare. Cloud computing computing for industry works into the deployment and distribution. Deployment, private, only one healthcare firm can can use the cloud facility. Community, a group of healthcare bodies can access the cloud. Public, the cloud is open for all stakeholders to access. Hybrid, the model combines elements of above mentioned deployment. By distribution, software as a service, the provider offers its IT infrastructure within where they deploy their applications, like Helium is doing. If you want to use the cloud facility of Helium, they provide it as a software for you as a service, and you pay for it and you can access it everywhere. Then as a service, the provider gives you an IT infrastructure operating system where the client deploys their applications. Platform as a service, the provider gives IT infrastructure and operating system and application and every other component in a ready-to-use platform. Know the key difference between the internet and infrastructure as a service and platform as a service. The advantages of transiting to cloud-based environments, flexibility. Executives like CIO of Count-Based Australian Descon Medical Center, John Alkman, MD, predicts that 5 years down the line, no one will use data center. There is some truth to this view. Imagine if you invest in a costly data center and end up using only a fraction of its capabilities. Also, when you invest in an in-house data center, there are a lot of overhead in keeping it running for a long time in terms of upgrade and maintenance. I mentioned it the other time. You have to look up for years, do everything, and after some years, you have to replace UPS. Your hardware needs to be replaced and everything. Your cabling has to be done over and over and again. Such scenario, cloud can prove to be a viable solution as it can scale up and down based on specific data storage or collaboration requirements. It can quickly adapt to the evolving demand and ensure that you get the right set of resources and service anytime you require it. The advantage, cost efficiency. I've mentioned CIAPS and corporate collaboration. with patients. This data record can now be streamlined under cloud computing. What's more, it can be made accessible to any physician or healthcare practitioner anywhere at any time from any location. I mentioned that earlier. Healthcare information exchange. Information it is limited or community. Physician collaboration solution. Remote patients can electronically collaborate with their physicians and continue receiving professional health care by video conferencing. Dr. Fatai mentioned that earlier too. An electronic medical record, all diagnostic report, lab tests, results, and other past health information of a single patient are stored in a cloud for global authorized access. Please take note of that authorized access. Advantage of transiting to a cloud-based, better efficiency. Enhanced liability. Full regulatory compliance. The risk associated with computing in healthcare, they are specialists. In a healthcare software domain, it can be difficult to find skilled developers who can carry specialization or integrate technology in the industry. On the same note, it is difficult to find class specialists in health domain, but this is getting better. We have Ilium now. Ecosystem. Adoption of cloud computing alone make for organizations to truly take advantage of the technology. They will have to connect it with Internet of Things, artificial intelligence, and data management technology. Here, I need to mention what AI and Internet of Things is now doing. During the COVID-19 era, where you cannot move, you cannot do anything, a old 22-story building was being operated by AI and Internet of Things. No security, nothing, you just walk there, face recognition, doors open, which floor are you going, you get there and you move everything. And we are getting there. Internet of Things, by the time we are serious with Internet of Things, all this oil bunkering and everything will be used and everything. So Internet of Things, like Doctor mentioned the other time, a lot of things is not only, when we talk about internet, is not only the Internet of Things, that everything that is connectable, all you just need is the internet access, and all our, why we are even upgrading from 4G to 5G and everything is to enhance and to help Internet of Things 4G. So switching from legacy system to cloud systems requires changing the complete process of handling tasks. It is important that organizations bring everyone up to speed with how it will translate into everyday job. Security risk. Storing medical data in the cloud is at the center of technology adoption. This, however, puts it at a risk of attack. It happens because in a typical cloud setup, one organization data is server with other care, but this one has been taken care of right now. What are the benefits of cloud computing in healthcare industry? Electronic medical. We keep hammering on this. Streamline collaboration, collaborative patient care, reduces data storage costs, offers superior data security, pave the way for data application, enhance patient safety, medical research, and will drive data interoperability. To wrap up, it is clear it can be driven by good technology. Vendors need to provide highest level of healthcare privacy, security, and computing deployment that Millennium Tech Ventures Limited, we understand the cloud is a prescription for better be compliance AI client bring organization the advantage of moving to cloud. So I want to thank you very much for listening.
Thank you very much. I hope the audience online is more receptive. Now, ideally, the way we close this format now is that we sit down and have a Q&A session. And this is where I was asking Olua to hold on to that question very well. So we ought to gather questions from the hall and from those online. But because of the kind of event we've had today, I think instead of cutting down, we're going to expand. So what we're going to do, we'll create a bank of interaction so that those who are online or who did not make it okay that are going to follow virtually will set in their questions. Then we'll share with all the three leads for the day. I think that will be more useful. But one thing I do hope, for the sake of the CIAPS community and our friends, is that we hope we can table something which, sorry, do you want to share your comment with us? There's somebody disrupting me. Do you want the microphone, young lady? You don't talk when I'm talking in my classroom, please. Thank you very much. So, as I was saying, I think what we're going to try to do is to find a triangulation where people who are interested in either the cloud management service or the general Helium thing can then continue the conversation as we go on. But above all, I'm hoping we can get some kind of preferential treatment for those who come to this program. I'm going to sit with you or Tutu Bashran, will contact and see how we can fashion that out. I know Mr. Oluwafemi Joshua, sorry? Oluwafemi Joshua has something in place already. So I think we can then find a way to triangulate and get that done. So that we don't bore everybody, that let's close. We normally close at 4, but we're behind time today because we didn't start work. So thank you very much, everybody. And we continue online as we started. Thank you very much.